Well, issues that have plagued Maryland's Developmental Disabilities Administration reached a point where the governor decided to cut its funding.
The General Assembly put up guardrails to rein in that agency as a result, but we're learning the people most affected by those cuts use self-directed care model.
Dave Collins explains how the changes could impact thousands of people.
Caitlin Valentine mastering lacrosse. This is her posse, her peeps. She's part of an indispensable social network built by parents of children who are developmentally challenged.
I love you, Mommy. I'll see you 5:30, okay?
Stacy Valentine is the organizer. She started a company called Grow for Change. She's a self-directed services caregiver.
And so during the day, they have my full attention. We go and do fun things, educational things, have all kinds of adventures, and just make it what they want to do, more robust for them, while they're still gaining skills and independence.
She's paid by the Developmental Disabilities Administration. DDA is overseen by the State Health Department. But audits determine because the agency experienced unsustainable growth and billing missteps, they're in a budget crisis.
Hey, ho, ho! These budget cuts have got to go!
This year, the governor cut spending by $126 million. But since it means a loss of matching federal Medicaid dollars, advocates say the total reduction is more like $252 million. The General Assembly put up guardrails to rein in agency spending and to hold it more accountable. Starting July 1st, the state will reduce family caregivers' wages by as much as 50% in some cases. Based on the Bureau of Labor Statistics Code, the number of hours family members can work will be capped at 40 per week, and no more than 60 combined hours among all family members. They worry it jeopardizes the future of a personal care model that's working.
If you want to learn how to cook, we can learn how to cook. If you need to learn how to read better, you can sit and read with your caregiver. It's all driven by the person who is receiving the services, as opposed to a larger model that has to fit everyone into a box.
That larger model is an institution. That's not something Genevieve Wyant wants for her daughter Tracy. And Judy Nagel feels the same way about her son Marcus.
If it were to stop, it would truly have a huge impact on Marcus's life. I mean, his whole life revolves around his self-directed services, his friendships, his engagement with the community. I really don't know where we would turn to if his program was to end.
She doesn't necessarily communicate very well, but I can tell what she needs. Not everyone can, and so the girl that we have taking care of her now, she's grown quite close to her, and she does really well with her.
The State Health Department is now requiring self-directed care vendors to become licensed providers. Stacy has to fill out a 17-page application and be accepted by July 1st. The process can take anywhere from 6 months to a year. Everyone, including Stacy, was given 60 days notice.
And it makes it difficult for families all across the board on what they're going to do with their loved ones if these services should stop.
It would probably end up being myself and my husband taking care of my daughter.
The state says there are 3,960 people enrolled in self-directed care. The Self-Directed Advocacy Network, or SDAN, surveyed many of its members' families. 90% of participants said they do not have a service transition plan. 45% indicated they don't know if their unlicensed vendor intends to apply to be a provider.
So each of these parents that I care for their loved ones would have to find a support staff. They would have to recruit, hire, and train an individual to care for their loved one. Some of these folks need tremendous care.
And that was David Collins reporting. Stacy Valentine says she is almost finished with the application process, and she's confident she will make the July 1st deadline. Of course, we will keep you posted.